All right. Hello, everybody. My name is Brian Hart. I'm the executive director of the Esselstyn Foundation. We are a 501c3 public charity that seeks to prevent and reverse lifestyle-related diseases through the promotion of whole food, plant-based nutrition. Today, you're in for a special treat. One of the forefathers of the plant-based movement, Dr. Caldwell B. Esselstyn Jr., is here to talk to you about his groundbreaking, earth-shattering research that really is, one of the batches of research that started this whole movement. And, his talk is entitled Reversal of Cardiovascular Disease Through Nutrition, Fact or Fiction. Dr. Esselstyn received his BA from Yale University and his MD from Western Reserve University in 1956, pulling the number 6 oar as a member of the victorious United States rowing team. He was actually awarded a gold medal at the Olympics. A lot of people don't know that. He was trained as a surgeon at the Cleveland Clinic and at St. George's Hospital in London. And in 1968, as an Army surgeon in Vietnam, he was also awarded the Bronze Star. Dr. Esselstyn has been associated with the Cleveland Clinic since 1968, and during that time, he served as president of the staff and as member of the board of governors. He chaired the clinic's breast cancer task force and headed its section of thyroid and parathyroid surgery. He's a fellow of the American College of Cardiology, and in 1991, he served as president of the American Association of Endocrine Surgeons. His scientific publications number over 150. And in 1995, he published his benchmark long-term nutritional research in which he demonstrated the ability to not only arrest, but reverse coronary artery disease in severely ill patients using a plant-based diet. So here to tell you all about his incredible research and to hopefully convince you that plant-based eating is the way to go is Dr. Caldwell Esselstyn.
Well, thank you. And Sherry, I think we really want to thank you for this kind invitation to share some of my research and clinical strategies so we can really sort of eliminate cardiovascular disease, which when you think about it, it's quite fascinating that we've known for 100 years that there are multiple cultures on the planet Earth where cardiovascular disease is virtually non-existent. Now, it's really kind of fascinating. For example, if you were a cardiac surgeon and you were to take your shingle and hang it out in either Okinawa, rural China, the Papua Highlands, Central Africa, the Tarahumara Indians in northern Mexico, forget it. You might as well plan on selling pencils. Why? They don't have cardiovascular disease. Why? Because they all thrive on whole food, plant-based nutrition. Now, for instance, here is the oldest slide in my presentation. And I took this when I was leaving Vietnam after having spent a year there in 1968 as a combat surgeon. The reason I show you this, I want the audience to know that when we autopsy our young GIs in Korea, at an average age of 20, 80% of those young GIs at autopsy already have gross evidence of coronary artery disease that you can see without a microscope. Not enough for their cardiac events yet, but here, already at that young age, this disease is getting established. Now, that study was then repeated 45 years later, this time looking at young women and men between the ages of 17 and 34 who had died of accidents, homicides, and suicides. And as you can see here, now the disease is ubiquitous, even in these young Americans. So in this country, you graduate from high school and you get a diploma, but you'll also then get the foundation for heart disease, which is not a good plan. And obviously, as they can keep eating the same Western diet, by the time we get to the late 40s and 50s, we then see this tsunami of cardiovascular disease that doesn't even exist in multiple other cultures. Now, we had a chance in 1941, 42, 43. We had a chance in World War II to really get it right. But sadly, we blew it. Now, in 1940s, in the Second World War, it was characteristic that when the Germans overran the Low Countries of Holland and Belgium, it was characteristic that they took away and they occupied Denmark and Norway. The Germans would take away their livestock for their troops. So their cattle, their sheep, their goats, their pigs, their chickens, their turkeys were now suddenly gone. And now these Western European countries had become plant-based with their nutrition. And it was doctors Strom and Janssen in 1951 publishing in England's leading medical journal, The Lancet. They looked at the death rate in Norway during this time period from heart attack and stroke. So let's just look at this together. If we start on the left in this diagram, you will see in 1927, heart deaths from heart attack and stroke were going up. And 1930, they were going up. 1935, going up. 1939, in come the Germans. 1940, going down. 41, going down. Look, it was really quite striking what happened in 1945. Who knew these up until then? Look at between 1939 and the death of Adolf Hitler in 45. Look what a plummeting there was of deaths from heart attack and stroke. Who knew? These Germans were these great public health educators. But what happened in 1945 with the death of Adolf Hitler, the cessation of hostilities in the European theater, and immediately back comes the meat, back comes the dairy, back come the strokes, and back come the heart attacks. But sadly, with that striking study, we still didn't get it right. Now, here we are looking at two arteries. The one on the right, obviously, is thoroughly diseased, and it's taken many years for all that disease to pile up with the cholesterol, calcium, muscle, and inflammatory tissue to build this blockage. You're probably saying to yourselves, when that small opening finally closes off, there'll be a heart attack. But interestingly enough, probably not, because interesting that really lesions that are this nasty looking only account for about 10% of heart attacks. But yes, you're going to have chest pain with this. You're going to have maybe some shortness of breath. But quite frequently, what happens with something that develops this slowly over a number of years, the body makes its own bypass. That is to say, when you do the angiogram, you will see these little streaming collaterals that literally go right around that blockage, and they are enough so that frequently when this small opening finally closes off, there'll still not be a heart attack, because these collaterals supply sufficient blood supply to the downstream heart muscle that it will survive when that small opening closes. But let's now look to the left. There's a normal artery, and I want you to focus on that delicate innermost single layer lining called the endothelium, about which we'll have quite a bit more to say today. Now, when you start eating this Western diet of pizza, cheeseburgers, milkshakes, the cellular elements in your blood supply get sticky, sticky, sticky. Your endothelial cells get sticky. Your white cells get sticky. Your platelets get sticky. Your LDL cholesterol gets sticky. Now, here is a slide from Peter Libby at Harvard. And even though I went to Yale, we have much respect, and we often share information that Harvard supplies. I want you to know that what you're looking at in the blue here is the flowing blood, just to get you oriented. And what's separating the flowing blood from the artery wall, you can see, is a single layer of purple cells, the endothelial cells. But let's focus now together on the upper left-hand corner of this slide. There you see your bad LDL cholesterol, which Peter Libby has painted orange, which has now been oxidized by the free radicals that come in this food that we've been eating. And the LDL cholesterol is now sticky, and it bumps up against the sticky endothelium and will migrate through a crack, a fissure, or an opening in the endothelium. And now we have your bad LDL cholesterol positioned in the subendothelial space. And you notice that from here, going from left to right, in the subendothelial space, Peter Libby no longer paints the LDL cholesterol orange. He now is painting it yellow to mean that it has been oxidized, and it is now no longer looked upon favorably by the subendothelial space. And the subendothelial space calls upon the SWAT team, which are our white blood cells, which are painted blue here, by Peter Libby, and they come across and behave like Pac-Man, going from left to right, gobbling up all those small, hard, dense LDL cholesterol particles. And it behaves sort of like Pac-Man in doing this until finally, when it gets all the way over to the right-hand side, and that macrophage or that SWAT team member is all absolutely chock full of these small, hard, dense LDL cholesterol particles, we then do in medicine what we do so often. We change the name. It's now called the foam cell. And the foam cell is significant because it really manufactures some nasty, nasty molecules called metalloproteinases: stromelicin, elastase, collagenase, and myeloperoxidase. What do they do that is so bad? Well, the metalloproteinases will progressively, if we look at the figure on the left, the metalloproteinases will progressively thin out the cap over the plaque. And if you look carefully, the plaque in that figure on the left, you can see that at its upper border, it's very, very thin, so thin that the sheer force of blood racing over that thinned out cap will rupture it. And now you have that seminal event having occurred. You have ruptured the cap over your plaque, and that leads to the extravasation, or the oozing out of, if you will, of plaque content into the flowing blood. When that happens, it activates our clotting factors like platelets. And in a matter of minutes after you have ruptured the cap over your plaque, you begin to see, as we see in this middle figure, we see a clot forming. And that clot is in and of itself self-propagating. So in a matter of further minutes, we now are all the way over to C figure on the right, and you can see that the clot has now grown to a size that it completely and 100% blocks the entire artery. All the downstream heart muscle now is suddenly no time for collaterals to develop. All the blood supply is suddenly eliminated, and it's all that downstream heart muscle is deprived of oxygen and nutrients, and it starts to die. And that's 90% of your heart attacks. Now, if I do my job correctly today, every one of you, and hopefully your friends and relatives, will be able to make themselves heart attack proof. Now, you're not going to do that with a pill or a stent or a bypass operation. You're going to make yourself heart attack proof by changing your biochemistry. How are you going to do that? You're going to change your biochemistry by becoming totally 100% whole food, plant-based nutrition. When that happens, you interrupt this entire cascade of events that I've just shared with you. You will not have the migration of the LDL cholesterol into the subendothelial space. You will not have the appearance of the SWAT team. You'll not have the development of you'll not be the development of the foam cell, and you'll not form the metalloproteinases. You'll not thin out the cap over the plaque. As a matter of fact, you will strengthen. You will strengthen the cap over the plaque. And when you strengthen the cap over the plaque, it cannot rupture. And when it cannot rupture, you now have made yourself heart attack proof. Now you can forget the x-ray. And this, I want you to focus on the opening of the artery, where the artist has given us an artery that is half filled with plaque and the other half is still open. And you can see the cells that line the part of the artery that's open. Those are the endothelial cells. Now, it was interesting that up until about 1980, we used to think of these endothelial cells lining all of our arteries as these cute little red bricks. However, that all changed in 1980 when Dr. Furchgott, working in his lab in Brooklyn, was taking the largest blood vessel, the aorta, from a rodent, a rat. And he would then make this sort of elliptical spiral staircase cut on it, which would actually go right through and kind of injure the endothelium. Then he would immerse it in a bath of saline and the artery would constrict. But one day, he decided no cut, no injury to the endothelium. and he immersed it in the bath of saline, and it dilated. Did it again, it dilated again. Now suddenly the race was on globally. What was the EDRF that Dr. Furchtgott had discovered? The endothelial-derived relaxation factor. Now, thank heavens, that term was with us for only about 8 years, when at the end of 8 years, 3 men, Dr. Furchtgott, Dr. Luignaro, and Dr. Murad, discovered that the EDRF, the endothelial-derived relaxation factor, was indeed a gas, nitric oxide. And 10 years later, in 1998, those 3 men received the Nobel Prize for the discovery of nitric oxide. Now, you're probably wondering, what is it about nitric oxide that makes it worthy of a Nobel Prize? Well, it's because of its remarkable functions. For example, nitric oxide will keep all the cellular elements within our bloodstream flowing smoothly like Teflon rather than Velcro. It keeps things from getting sticky. Number 2, nitric oxide is the strongest blood vessel dilator in the body. When you climb stairs, the arteries to your heart, the arteries to your legs, they widen, they dilate. That's nitric oxide. Number 3, nitric oxide will protect the wall of the artery from becoming thick and stiff or inflamed and protect us from getting high blood pressure or hypertension. Number 4 is the absolute key. A safe and normal amount of nitric oxide will protect us all from ever developing any blockages or plaque. So literally, everybody on the planet Earth who has cardiovascular disease has their disease because by now, in the previous decades, they have so sufficiently trashed, injured, compromised, and turned their endothelial system into an absolute train wreck that they did not have enough nitric oxide to protect themselves from making blockages. However, the good news is this: it is not a malignancy. And once you can get patients to understand that never, 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 ever again are they to pass through their lips a single morsel that is further going to destroy an already train-wrecked endothelium, because then the endothelium will recover, make enough nitric oxide so we can not only halt disease progression, but we will often see elements of disease reversal. Now, by this time, I've usually recognized the fact that many in the audience will be saying to themselves, golly, I wonder what my level of nitric oxide is. We don't really have a handy way of measuring that in the doctor's office yet, but the way it's done in the research setting is you take an ultrasound probe and place the ultrasound probe over the brachial artery at your elbow, and there is a readout of the diameter of this brachial artery. And the next thing is done is you then will encircle your upper arm with a blood pressure cuff that you inflate above systolic blood pressure, so that for 5 minutes you have absolutely zero blood flow to your forearm and hand. And the interesting thing is that when you release the cuff after 5 minutes, you then remeasure with the ultrasound probe the new diameter of the brachial artery. And in a normal individual, it'll be 30% greater due to the outpouring of nitric oxide while that tourniquet was in place. Now, the next interesting thing that happened was when Dr. Robert Vogel, chairman of cardiology at the University of Maryland, took a group of healthy young subjects to a certain fast food restaurant, which is characterized by arches which are golden. Now, it was interesting that half of the group had the cornflakes, then they had the brachial artery tourniquet test. Normal. The other half ate a meal of hash browns and sausage. Within 120 minutes after that meal, they could not dilate the artery. That single meal had so trashed, so injured their endothelial cells, they could not make enough nitric oxide to dilate the artery. But being young, as they followed them into the late afternoon and early evening, they began to recover. However, you and I know that the next morning for breakfast, it'll probably be scrambled eggs and bacon, Lunchtime, it'll be white bread with cold cuts and mayonnaise. Supper time, it'll probably be a baked potato with sour cream, lamb chops, vegetables soaked in butter, ranch dressing on a salad, and ice cream for dessert. Here in the good old USA, starting in childhood, all day long, we absolutely trash and injure our endothelial cells. Now, this simply is a summary of what we just talked about. The functions of nitric oxide. It prevents stickiness, strongest blood vessel dilator. It avoids arterial thickening, prevents blockages, prevents smooth muscle migration into the plaque, and it can destroy Darth Vader, the foam cell. Now, although we have time today only to look at the endothelial cell, the other three, these are all wonderful, actually, defensive mechanisms protecting our vascular system. But I think the take-home message from this slide is that all of you should know that when you're eating whole food, plant-based nutrition, you are optimizing all of these protectors. Now let's go to where the rubber meets the road. This is my first attempt at getting patients seriously ill with heart disease to eat plant-based and see if we couldn't halt or reverse their disease. Now, the whole idea here was to have them eat a diet that was completely free of anything that was going to injure their endothelial cells. So we did not want them to have a drop of oil, olive oil, corn oil, soybean oil, safflower oil, sunflower oil, coconut oil, palm oil, oil in a cracker, oil in a chip, oil in a piece of bread, oil in a salad dressing. Oil injures endothelial cells, as does anything with a mother or a face, meat, fish, chicken, fowl, turkey, and eggs. I do not like dairy, milk, cream, butter, cheese, ice cream, and yogurt. And we want to avoid caffeinated coffee, and what's not listed here is sugar. Now, the interesting thing is that I'm sure that some of you had concerns what I said about oil. Here's an example of a peer-reviewed scientific study on oil. And it shows that olive, soybean, and palm oil intake have a similar acute detrimental effect over the endothelial function in healthy young subjects. Now, some recent work actually from Stanley Hazen from the Cleveland Clinic. Stanley Hazen took these animal-based products that you see listed here, and he found that these are the ones that omnivores were eating. And they contain the molecules of lecithin and carnitine. And what he found was that when persons who are omnivores were eating these animal products, their lecithin and carnitine were being metabolized by a certain bacteria in the microbiome, in the gut of these omnivores. And when the bacteria metabolized the lecithin and carnitine, it produced a molecule called TMA, trimethylamine, which is rapidly oxidized in your liver to trimethylamine oxide. And trimethylamine oxide will injure your blood vessels. So let's look at the schematic of this. Here you see on the left, lecithin and carnitine. You eat it. If you're an omnivore, you have gut bacteria that convert it to TMAO, which will injure your blood vessels. But the key thing that Stanley Hazen found out is that when he studied persons who were totally plant-based, if he gave them a lamb chop and then measured their blood, they did not produce TMAO. Why? Because they did not contain the bacteria in their microbiome that was able to produce TMAO. However, if you're plant-based and you keep eating that lamb chop every day, within a week or so, you then also will have produced bacteria that can then create TMAO. But it's a very powerful argument if you get into a struggle talking to people who are paleo or keto with their diets. All right. Now, This is the one slide in my presentation that has nothing to do with cardiovascular disease, but it is such a striking moment historically. I like to include it because it was in 2015 that the World Health Organization, imagine it, representatives from throughout the globe got together and agreed that the red meat and processed meat have the same level of carcinogenicity, the ability to make cancer, as smoking cigarettes. Pretty exciting. Let's go back to that first study now. So we'll mention what we don't want you to eat, but what do we want you to eat? We want you to eat all these marvelous whole grains. Whole grains for your cereal, bread, pasta, rolls, and bagels. 101 different types of legumes, lentils, and beans. All these marvelous red, yellow, and green leafy vegetables, white potatoes, sweet potatoes, and some fruit. Now, it's interesting that about a decade ago, I made a change. And the change was motivated by our increasing awareness that the endothelial production of nitric oxide was age dependent. For example, you never heard of a boy or girl at age 8 having a heart attack, right? No. Why? They have nitric oxide coming out of their ears. But by the time they're 50, beautifully healthy, they now have 50% of the nitric oxide they had when they were age 25. And by the time you're 80, you've lost 70%. So I made 2 different changes a decade ago in our program. One, a way to achieve greater stimulation of the endothelial production of nitric oxide. And secondly, and most important, take advantage of the newer research that showed us that the consumption of green leafy vegetables could also enhance nitric oxide production. I want to share that with you right now. I need patients with heart disease to chew, not smoothies, not juicing, to chew a green leafy vegetable roughly 6 times a day, roughly half the size of their fist, after it has first been steamed in water 5.5 to 6 minutes. So it's now nice and tender. And then you must anoint it with several drops of a delightful balsamic or rice vinegar. Why? Because research has shown us that the acetic acid from those vinegars can restore the nitric oxide synthase enzyme, which is contained within the endothelial cell and responsible for making nitric oxide. So you're going to chew this alongside your breakfast cereal, again as a mid-morning snack, again with your lunch and sandwich, that's 3, mid-afternoon, 4, dinner time, 5, and of course I adore it when you have that evening snack of arugula or kale. Now, once you have the arugula or kale, what is the second benefit from chewing the green leafy vegetables? It restores the capacity of your bone marrow to make the endothelial progenitor cell. What do? The endothelial progenitor cell replaces our senescent, injured, worn out endothelial cells. Number 3, now the third benefit from chewing the green leafy vegetable. When you're chewing that green, you are chewing a green nitrate. As you chew the green nitrate, it is going to mix with the facultative anaerobic bacteria that reside in the crypts and grooves of your tongue. Those bacteria are going to reduce the green nitrate that you are chewing to a nitrite. Once you swallow the nitrite, it is now your own gastric acid, which is going to further reduce the nitrite to more nitric oxide. So think about it for a minute. For minimal expense, no hideous side effects. What you were doing, literally, all day long, morning to night, dawn to dusk, you are absolutely replacing nitric oxide, the very molecule, the deficiency of which gave you this disease in the first place. Now, there is a caveat to this. Toothpaste with fluoride, public drinking water with fluoride, or mouthwash will injure the beneficial bacteria in your mouth, and I do not like antacids, because antacids will decrease your gastric acidity and you will be unable to reduce the nitrite to more nitric oxide. All right. No oil. Now let's do this. Let's look at some angiograms of disease reversal. This is from this original study where the patients were insistent upon knowing this, as were their cardiologists who had referred them. And these were all reviewed, these angiograms, in the Cleveland Clinic Angiography Core Laboratory. So when I give you a certain percent of reversal, I know that it's accurate. This happens to be a 67-year-old pediatrician where you're looking at the left anterior descending coronary artery. And from the arrow on the left to the arrow on the right, the vessel is now 10% wider. And this is about as small an improvement as the naked eye can see. It's a little easier with this 58-year-old factory worker where you're looking at the circumflex artery to the back of the heart. This was described from the arrow on the left to the arrow on the right as a 20% improvement. And here we have the right coronary artery in a 54-year-old security guard. And from the arrow on the left to the arrow on the right, that was described as a 30% improvement. This happens to be a surgical friend and colleague of mine, Joe Crow. He's in the first chapter in my book. And at age 44, in 1996, Joe began to get chest pain, cholesterol 156, not a smoker. He was not diabetic. He did not have high blood pressure. He was not overweight. He exercised regularly, had no family history. Chest pain. Cardiology worked him up, could find nothing. In October of 96, a month later, he finished his surgical schedule, sat down to write postoperative orders when suddenly the elephant was sitting on his chest. Pain in his left jaw, left shoulder, left arm. He was having a heart attack. He was whipped down to the catheterization laboratory. They start the catheterization. He had a cardiac arrest. They resuscitate, finish the catheterization, one more cardiac arrest, resuscitate, stabilizes, goes up to the floors for 3 days, and stabilizes, and then he's discharged. But he's very depressed. And he's depressed because at the time of this angiogram, his left anterior descending, as you can see here in the yellow bracket, the entire lower 1/3 was sort of moth-eaten and diseased. Over too long a segment, you just cannot jam in stent after stent after stent. Too far down the artery for a bypass. So he was very depressed. So 2 weeks after his heart attack, Ann and I had Joe and his wife out for supper. Joe, come on, you've been eating this horrible Western diet. You got the typical Western disease, and I really think you ought to consider going plant-based. We've got 10 years of data. And he said, well, I think I'll give it a shot. I'll give it a try. They couldn't do anything else for me, but I'm not going to take any of those statins. I don't trust them. Too many side effects. I said, fine. I said, that's your call. Well, he became the absolute personification of commitment to whole food plant-based nutrition over the next 2.5 years. His total cholesterol plummeted. His LDL cholesterol went from 98 to 38. And then he had another follow-up angiogram. Now, up in the surgical office areas, our doors are about 3 doors apart. And at noontime, on the day that I knew earlier in the morning Joe had his follow-up angiogram, I walked over to his door, opened it, and there he was sitting behind his desk. Joe, I understand that you had the follow-up angiogram of mine, sharing with me how did it go? As he got up from his desk, came around, put his arms around me and said, I think we're doing okay. And I said, well, what would be the chances of my seeing the angiogram? And he said, sure. Bingo. That's pretty exciting. That artery is clean. Now, not everybody is going to have that kind of a result. But when the artery plaque is young and soft and made up of inflammation, fat, and cholesterol, the body can do a remarkable job at reversing it when you have them absolutely stick to the program. But the exciting thing is that even the older patients where the plaque is stable, maybe it's made up of fibrosis, scar, and calcification, and the likelihood of its going away is minimal. Even those patients can get back to full activity of daily living without restriction. And it's going to be my obligation to show you that before we finish up today. I want to show you another one. This happens to be a 45-year-old gentleman from Florida. Had his heart attack July 14th in 2017. And at the time of his angiogram, you can see where the arrow is. And this is a branch of the obtuse marginal artery to the back of the heart. And he had multiple other blockages. The one at the arrow was reported as an 80% blockage. And because of the other blockages as well, the cardiologist recommended that he have bypass surgery, but the patient said no. I'm reading a book called Prevent and Reverse Heart Disease. I'm going to do it by diet. Of course, the cardiologist said, no, this will never work. But a year later, they repeated the angiogram, and what was formerly 80% blockage, a year later was now 40% blocked. Well, at this point, there was a switch in the cardiologist, and his new cardiologist, after a year and a half to January of 2020, wanted another angiogram, and now it was completely gone. And these two angiograms raise a very interesting issue. Why isn't it that every single patient with cardiovascular disease is offered this absolutely profoundly safe, inexpensive way of treating the causation of the disease and having it go away? It is really almost unconscionable that the patients aren't at least offered this as an option. Now, the reason that I have these angiograms, apparently after this most recent one that you see here was when the patient wrote me a letter thanking me for writing the book Prevent and Reverse Heart Disease, and at the same time, he sent me the copy of these films. So now the question coming back to the study, there were 18 of these patients that stayed with us for the whole 12 years. And it was interesting that what I wanted to know was that in the 8 years prior to coming into our study, while they were under the care of expert cardiologists, these 18 patients had had 49 coronary events of worsening disease in expert hands. But once they came into our program and were followed for 12 years, 17 of those 18 had no further events. One little sheep after 6 years wandered from the flock, got into the lamb chops and the French fries and the glazed donuts, more angina, had to have a bypass. But now he's back with the flock, but makes the point that I'm trying to share with you today. So, as excited as I was about this, what we were getting with results for that study, nevertheless, we had our critics. Dr. Esselstyn, that's a small study. What makes you possibly think that you can do this with a larger group and get similar results? So we did. And you can see here that of the 198 patients that we had in our study, 2 had been lost to follow-up of the original 200. 177 patients, that's 89.3, almost 90%, were adherent to the program. And I think it's very interesting that if you're going to have a patient make a lifestyle change, you must really show them respect. And our present format to make that happen is I run a cardiovascular disease seminar once a month, usually no more than 18 or 20 patients. And I will insist that my secretary will give me a copy of their phone number about 2 weeks beforehand so I can call every one of these patients myself, get my arms around their study and at the same time provide them with an opportunity to ask questions of me so that coming to the seminar, we have a strong platform from which we can move forward. And the actual seminar itself is 5.5 hours on a single day. And I know of very few cardiologists who will visit with their patients for 5.5 hours and speak with them 30 or 40 minutes 2 weeks beforehand. Because when you do this and you explain the science as you're being as is being shared with you today, when patients can understand the science that they have their disease because they destroyed their endothelial capacity to make nitric oxide, it really becomes very simple, especially when they have defined for them the foods that will injure and the foods that will help. Now, how did they do? We had one fellow who completely misbehaved when he was in China and had a small cerebellar stroke from which he recovered. That was only 0.6% of that one patient out of the 177. Of the 21 patients who were non-adherent, 62% had disease progression during that time period. I decided it was appropriate to check our results against some of these better known cardiovascular studies. And let's start with the box on the far right. And that's the Lyon Diet Mediterranean Heart Study, where at the end of 4 years, 25% had either had a major cardiac event of heart attack, stroke, or death. The box next to it on the left was from the Columbia Presbyterian Hospital in New York City, the natural history of coronary disease, 20% heart attack, stroke, and death at 4 years. To the left of it, the Bill Bowden Courage study, 19% heart attack, stroke, and death. Then go to the left of that. There we are. One patient, 0.6% of the 177 who were compliant. That is over a 30-fold difference. Why is there such a profound difference? The difference is because we were the only group that was treating the causation of the illness. And there's been a basic covenant of trust ever since the days of Hippocrates that whenever possible, the caregiver will share with the patient what is the causation of the illness. And sadly, today in cardiovascular medicine, that is not being done. So, if we summarize, there's no mortality with the diet, there's no morbidity with the diet, there's no added expense, you've got to eat, and the benefits improve with time. And today, almost all patients who have had a heart attack are walking around sadly with this sword of Damocles hanging over their head. When is the other shoe going to fall? Well, nonsense. They know they never have to have that second heart attack. Now, here we have, interestingly enough, on the left, that is the pulse volume in the right ankle of a 54-year-old gentleman with heart disease who also had a partially blocked artery in his thigh that was causing him to have this low pulse volume. For example, when he walked across the Skyway to my office, he had to stop 5 times because of claudication or pain in his right calf. Well, then the interesting thing was that I was so focused on his heart that I totally forgot about his leg. And it was into the study by about 10 months that he said, Dr. Esselstyn, do you recall when I first started seeing you, I was stopping 5 times crossing the Skyway to your office? Yeah. He said, in this last month, it got to be 4 times, 3, 2, 1. He said, I don't stop anymore. The pain is gone. He said, fine, Don, back you go to the vascular lab. And you can see on the right, bingo, suddenly his pulse volume was double what it had been. We now had suddenly, within the few months of starting this study, we had absolutely irrefutable, rock solid, scientific study that showed that you could reverse cardiovascular disease with food. And somebody's going to say, well, wait a minute, what about the statin drugs? Well, it was 1986 and there were no statin drugs then. So I've given you 2 examples today, Don here and Dr. Crow, who had no statins, who were able to profoundly reverse their disease. Here's another. This happened to be a 78-year-old high school chemistry teacher. And in his retirement, he and his wife loved to enter square dance contests. And it was during the fast square dance that he was getting bilateral claudication pain in his calf muscle. So he saw a group of vascular surgeons and they made the image that you see here, but he didn't like the big operation that they were suggesting and found us over the internet, came for counseling and said, Dr. Esselstyn, if I choose your method, how long will it take me to get rid of this bilateral calf pain? So I looked at him with great wisdom in my face and said, probably about 10 or 11 months. Well, 3 months later, I got a phone call. Dr. Esselstyn, you do not speak the truth. The pain is gone. Now, I have no idea where any of you in the audience are coming from, but in Cleveland, if you watch on television either an athletic event or a mystery, just before the advertisement comes on, you will hear the mellifluous tones of the announcer say something like, when the moment is right, will you be ready? Now, we all know that the penile artery is really quite tiny compared to the coronary artery to the heart. So not infrequently, before somebody comes down with heart disease, they may find that they are no longer able to raise the flag. However, all is not lost. Not infrequently, 10 or 11 months after I've counseled somebody, I'll get a phone call. Dr. Esselstyn, yes, this is Mr. So-and-so. Sure enough, good to talk to you. Yeah, doc, I really thought I ought to call you because recently something has come up and I'm wondering if I don't owe you another check. Now, I promised you before we finished up what we would do about the older patient who has a blockage that is made up of scar and fibrosis and calcification, not likely to go away. How is it that they improve? Well, let's take the example of a downtown Cleveland stockbroker who has a cholesterol of 248 when we first see him. And this PET scan, the PET rubidium dipyridamole scan, the PET scan that you see here, if the heart muscle is orange or yellow, that is pretty good perfusion. But as you can see in the PET scan on the left, at the right-hand part of that, it's green. And the green indicates to us that it's getting poor muscle perfusion. So I counseled him at the time of his first PET scan on the left. 10 days later, his cholesterol was down to 137. And then 3 weeks later, he came in and had another PET scan. And you can see it's all back again. How can that be? So let's just do this. What we're looking at here is the heart without any muscle. You're really seeing all of the blood vessels. And you can see the 3 main blood vessels that get all the publicity because they are epicardial. They're riding on the surface of the heart. They're the ones that get stents and bypasses. But where do they all go? They all eventually dive into the muscle. And you can see the thousands and thousands of interconnecting, lacing blood vessels. You can see how richly supplied with blood the heart is. And at this point, I called our Cleveland Clinic cardiovascular department head in pathology, Rodriguez. And he happens to dissect about 200 hearts a year from the deceased. And I said, Rod, how often do you ever see, once the artery has dived into the heart muscle, how often do you then see any coronary artery disease or blockage within the artery? His answer, never. Now, I think we had the answer to what was going on. Why were they getting better? Especially if you didn't get rid of the blockage in the epicardial artery. Because what happens is this. When I first see these patients, they come to us, their endothelial cells have been so beaten down, they are barely making any nitric oxide. And also, to compound that, they are now actually, the endothelial cell is your enemy. It is making 2 molecules, endothelin and thromboxane, which happen to be vasoconstrictors. So those thousands upon thousands of vessels that you see on this slide, those small ones intramuscularly, they are not blocked by some type of cholesterol or blockage in the artery. Their opening is clean, but they are all compromised because they are pinched and narrowed because of endothelin and thromboxane. So what happens to these patients, fortunately, very promptly, as soon as they stop any injury within the day of seeing us, they stop any further injury to the endothelium. It starts making more nitric oxide, the vessel dilator, and most important of all, it stops making endothelin and thromboxane. So literally what you're doing, you're entirely opening up that entire cascade of thousands of intramuscular vessels. And as you may recall, in physics, the law of flow through the hollow viscous, Passé's law, it is is related. The amount of flow is related to the fourth power of the radius. Translation: a tiny increase in diameter, a huge, huge increase in flow. So it's not at all uncommon that when we see a patient who has a stable angina, and they go through the program, literally within 6, 8, or 10 days, if they used to have to walk 2 blocks before they got any chest pressure, they now have to walk 6, 8, or 10 blocks before they get chest. And they know that what they're doing is absolutely curing their disease. So let's summarize the mechanisms of disease reversal or methods of identifying a disease reversal. We talked about the coronary angiogram, stress test. We've shown you the PET scan. Same thing can happen to the artery in the neck. We see reversal there. Pulse volume we've talked about. And of course, the 3 symptoms can be reversed of angina, claudication, and erectile dysfunction. Now, I always like to wrap it up by showing you the A building at the Cleveland Clinic, where on the 8th floor, I was involved with surgery for many years. But also, I wanted you to know what the trees look like in February in Cleveland. However, after I retired from surgery, I was rehired by the clinic to work at the Wellness Institute. And the Wellness Institute, the budget is more modest, but the morale is quite high. And I always like to point out that of the things that I've learned in medicine, yes, brains are important, but nothing is as important perhaps as persistence, 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 best exemplified by this young damsel in Life magazine, 1939, trying to learn how to do the splits, but she's tried and tried and tried. But the other day in Rockford, Illinois, they spotted her and she had got it right. I want to say thank you for this invitation. It's been fun to share this with you.